Today I talk about my weight loss. And so I really want to do that, but I'll do that another time. We have a special guest today, um, coming to us to talk about weight loss and, what happens after weight loss, especially if you have extreme weight loss. Do you look at options of getting rid of that excess skin or having a tummy tuck or having a breast augmentation? Or having lipo, any of those things. We're going to get to it today. So I'm excited. I'm excited. I'm excited. So today we have Dr. Derek Cody, and I'll bring him up in a second. We want to see who's in the chat. And then I put a question on my community tab. It was like a little poll. And I don't know if people really answered the poll. So I'm going to have to go back. I'm going to look at this poll really quick. Did people answer this poll? But I wanted to know, would you have, plastic surgery? And if so, what would it be? What would it be? What type would you have? So I'm in my community tab. You guys can't see it. I didn't show my screen. Um, so we have skin removal. We have 50% of people said skin removal. We had 28% said a tummy tuck. We didn't have anybody for liposuction. And then we had 22% for a breast augmentation. So wow, wow, wow. That's pretty cool. That's pretty cool. So people would have procedures. So I want to ask you, before I bring him up, what are some questions that you would ask a plastic surgeon? What are some questions that you would ask a plastic surgeon? And I had a question in my mind and I didn't ask it. I didn't write it down. So I'm going to write that down. A question just kind of popped into my head. So what questions would you guys have? What procedures would you look at? Oh, I see one. I don't even know what that means. Okay, Derek will know though. Derek will know. Okay, Debbie said I would have all of the above. Oh my goodness. Oh my goodness. Okay, all right. So let me see. Any questions? Uh Oh, Traces of Twan. Oh, she says she's coming over. Okay, okay. All right. So I just want to shout out the people that are in the chat right now. And then I'm just, without further ado, going to bring up Dr. Cody. So we have Delilah. Hey, happy Sunday. We have Taisha. We have Jazzy. We have Mindy. We have Brown Velvet. We have Taisha. We have Mel. We have Pam, we have Beverly, we have the round mound of Zepbound. How are you? We have Jen, we have the Turtle Diaries, we have Mindy. Hey, I think I said Debbie. We have Traces of Twine, we have Bellflower. How are you? How are you? All right, so basically the gang's all here. We have Ro Woods. How are you? Let's see who else I see. We have Mia. Hi, Mia. Hi, Mia. So happy Sunday. Without further ado, we are going to bring up Dr. Cody. All
Hi,
right.
Shay. Thanks.
Hi, how are you?
I'm doing well. How are you doing?
I am doing good. I can tell you're in your office.
Yes, I am. I am. And please excuse my voice. I'm just a little bit under the weather, but I'm super happy to be here with
I'm
you guys
glad you
today.
are here. So I'll just tell you a little bit, how do I know Dr. Cody? Dr. Cody and I have been friends for, I think, 35 years now. Since
Yeah.
1990, we went to college together. So we've been friends for a long time. And I will say he is the nicest, most, just like a compassionate, kind guy, just a gentleman. Like if I could think of a person to call a gentleman, it would be you.
Thank
And
you.
he's also, anytime I've asked him to do anything for my students to come and, talk, he has always been willing to do it. So I was so excited he agreed to come on YouTube. So I appreciate that. I know you personally. So I know, all about what goes on with you and your plastic surgeon, surgery and some things about that. But can you tell our viewers here, our subscribers, my subscribers here, I have a little tribe here on YouTube, a community. And a lot of these, ladies and gentlemen in the chat have lost a lot of weight. And so that prompted me to think about, why not have a plastic surgeon on to talk about some options, especially when you've had extreme weight loss. So I would like for you to tell us, first of all, tell us a little bit about yourself, and then we'll get into our little interview, and then we'll answer some questions and hopefully be helpful.
Yeah. So, as you said, Shay, we've been knowing each other since college. And so I'm so honored that you would think of me to come onto your show and share some information about plastic surgery and how it relates to massive weight loss. So a little bit about myself. I'm a board certified plastic surgeon. I specialize in aesthetic surgery of the face and body, as well as some comprehensive microsurgical reconstructive procedures. When it comes to plastic surgery, it's really something that I'm passionate about. We have a diverse number of procedures that we can offer patients that will help them obtain their goals. And a lot of those goals can be reached safely if done with a board certified plastic surgeon, someone who has experience in the things that you're looking for, someone who's willing to sit with you and learn what your goals and desires are and help you find a way to achieve your goals safely. So to become a plastic surgeon, just for background information, essentially you go to medical school after college. And then training after medical school is usually 6 to 8 years of residency training. And sometimes you do an extra fellowship, which could make it 9 years of training before you're really out there practicing by yourself. So it's really a comprehensive program to make sure we're safe and efficient and effective in what we're doing.
Okay, great, great. And so I have one of the questions I have for you is I saw you before I ask my question, I also want to say I saw you, so your specialties are plastic and reconstructive surgery. So
Hmm.
why
Hmm.
do they say plastic and reconstructive? Is there a difference between the two?
It's a good point. So traditionally, plastic surgeons went as plastic and reconstructive surgeons. Most commonly today, we just refer to ourselves as plastic surgeons. The word plastic comes from the Greek word plastikos, which means to form. So we're sort of formative surgeons. The reconstructive surgery we do may be for patients who've had facial trauma from car accidents or gunshot wounds or interpersonal violence. I do a lot of breast cancer reconstruction as well for women who desire to kind of maintain and restore their form and shape after breast cancer treatments. I do reconstructive surgery for limb salvage procedures as well, and some complex facial reanimation surgery. So that's the reconstructive side of our practice. And what's
Wow.
nice about being a reconstructive surgeon and an aesthetic surgeon is they both feed upon each other. You know, being a good reconstructive surgeon makes you a better cosmetic surgeon. Being a good cosmetic surgeon makes you a better reconstructive surgeon. And it's really helpful to have both the understanding of the complex procedures as well as the aesthetic surgeries.
Okay, so I wanted to ask about some of these, and I hope I don't mess up the words. But so you said that you do, I'm just, going from what I know, your areas of interest is you just talked about the reconstruction surgery with the face and the body. What is micro surgical breast reconstruction? Is that what you also talk? Is that like a breast
Yeah,
augmentation?
so that's an advanced, yeah, that's an advanced form of breast cancer reconstruction. And so there's a number of different ways that can be done. Oftentimes patients are just given an implant, but we know there can be long-term um, maintenance and issues with implants, but the state of the art is now to use the patient's own tissues. And with that, the reconstruction has a blood supply. So it's warm, it's natural, it's soft, and there's no late complications with it because it's your own tissue. And we can do that in a way that preserves the function of the donor site. That's very important because after this procedure, we want you to live an active, healthy, functional lifestyle so that you can be the person you were before cancer. So that's a form of a transplant operation where the tissues from your lower abdomen, the extra skin and tissues there, can be transplanted to the chest wall to restore the breast shape and form. And it's really the gold standard. So it requires someone who has expertise in microvascular surgery, and that's when you're sewing together arteries and veins that are smaller than 2.5 millimeters.
Oh, wow.
So
So
that's done under.
micro.
So,
So that's where the word micro probably comes from.
yeah, so that's done under the microscope, and these vessels are usually somewhere between just smaller than a millimeter to 2 millimeters in size.
Okay. Okay. So my first question for you is about loose skin, because I think that's the one thing we hear a lot after extreme weight loss, and now you are familiar. We talked about this weight loss with the GLP-1 medications. So my question is, why do so many people experience loose skin after a significant weight loss? And what factors determine how severe it would be to, where they would opt for plastic surgery or any kind of reconstruction?
Yeah, so the loose skin comes from skin and tissues that have been stretched beyond its ability to retract. And the body is really amazing that it can tighten up a fair amount of skin. It takes a little while for that to happen. And one of the reasons that's important is because sometimes it's advantageous for patients to allow their body to tighten that skin up as much as possible. We know there's a limit to that, but you still want to take advantage of that tightening because then the surgery to address the residual skin may be a smaller surgery, something that's going to be more tolerable and less prone to complications. So the elastic properties of the skin help to tighten the skin over time, but once the skin has been stretched so far, that tightening will limit the amount of skin that can retract backwards to its pre weight gain size, and then that's what we want to remove with surgery.
Okay, okay. So have you noticed so for people who lost weight using the GLP-1 medications like Ozempic, Wegovy, Mounjaro, Zepbound, is their loose skin any different from those who lost weight just without the medication?
So we haven't seen any differences in the skin quality, particularly
Okay.
with the GLP-1 medications. Again, the quality of the skin is going to be related to mostly patient age, health status, and there are a few patients who have a few underlying conditions where the skin healing can be different, but these are kind of unique situations like Ehlers-Danlos patients, and that wouldn't change whether you were a GLP-1 patient or someone who lost the weight by diet and exercise or even bariatric surgery. We do see a little difference in the skin quality in patients who had some of the surgical weight loss procedures, and that the malabsorptive state can sometimes lead to slower healing.
Okay, okay. So what would make someone a good candidate for a skin tightening or skin, removal?
So often when I see patients who are desiring sort of body contouring procedures after weight loss, we have a nice conversation about what their goals are, their overall health status. Again, we want this operation to be safe, efficient, and patients to come back after their surgery with excellent outcomes and enjoying their new body. So good candidates are patients who have maintained their weight loss, usually for 6 months or sometimes out to 12 months or so. People who are understanding that this is a contouring surgery and not a weight loss surgery. So we want you to be at your lowest weight so that the contouring effect can be at its maximum. So again, good candidates are overall good health, a good understanding of what the procedure can accomplish. Patients who are still motivated to maintain the lifestyle modifications that they've done to get to this point. And then we make sure that your heart, your liver, your lungs, your kidneys are all in good shape so that they can tolerate the surgery ahead and the healing and recovery phase.
Okay, so and this is the scenario, so you may not be able to answer it, but just to give you some context on what I'm thinking. So if let's say I got down to 140 pounds, I lost, and I had a lot of hanging skin that interfered with my day-to-day, ability to function. And this is a procedure that the primary doctor said I should have. But I'm not at my BMI. My BMI is still considered, well, maybe not 140 pounds, let's say 170. My BMI is still not where it should be. So would you look at me individually as a, case by case, or do you have like a standard, like you have to be at this BMI with all your markers, on point or at the target level, or is it case by case?
So absolutely, I think the beauty of medicine is that we're all so different. So we cannot really lump people into categories of once your BMI is here, we can operate because it's so much more than the BMI. And actually, there's some new data that kind of suggests that there's some better measures than BMI. And so we really look at patients individually, and that's why you really need to have a conversation with a plastic surgeon who's well versed in this sort of surgery to kind of treat you as an individual because every surgery is individualized. There's no surgery, even it may be a body contouring procedure, but it's going to be really individualized to that patient's health status, their desires, their needs, and what can be achieved safely and efficiently for that patient.
Okay. Okay. Very good. I'm glad to hear that. So I do want to say, for those listening out there, you said you should be able to hopefully you're maintaining that weight loss for 6 to 12 months. Now, why that time period? And I want to just add, I remember years ago, I was having a little gathering at my house and you were there. This was before COVID. And some of the ladies were talking about, having this surgery or that surgery. And I remember one of the things that stood out is you said, this is not like a weight loss surgery. You have to really be at your weight. You have to have your weight loss before you even consider doing some things, not just the loose skin, but tummy tucks and all of that. And you did say you have to be able to show that you've maintained it. And so why is that 6 or 12 months? Why is that important?
Well, I think it's important because one, once you go down this path for surgery, it's a big undertaking. It's a procedure that you're going to be under anesthesia for several hours, and you want to make sure you're ready to maximize the effect of this procedure. If you're not at your goal weight, your results can be less than optimal. If you have the surgery and then you go on to lose additional weight, you can have redundant or loose skin again. And then you're looking at maybe a second surgery or a revision surgery. So to avoid revisions, to optimize the outcomes with one operation, it's best to have patients at their lowest weight. And certainly there are a lot of docs who will kind of vary those time frames. But again, we know that if you're at the lowest weight, that means more skin can be removed safely, and the complications are going to be lower. And then typically patients are going to be happier for the long term because they won't have lost weight after their surgery and have loose skin that recurs because the skin didn't tighten up after they lost additional weight after surgery.
That's an excellent point. I didn't think of you could have the surgery and then lose additional weight, and now you need more or want more surgery because you have additional hanging skin. So that's a great, great point. So let's talk now about tummy tucks, and let's talk about body contouring options because that's another thing I know you do. So can you explain the different types of tummy tucks, mini, full, extended? That extended one kind of intrigued me. And how someone like how would you know what is the best option for the patient? So if I came in saying, Derek, Dr. Cody, I want a extended tummy tuck, would you steer me a different way? So before you answer that though, tell us the difference between the type.
Yeah, so we have so many procedures that are available to us as plastic surgeons that really allow us to treat patients with a number of different situations. So most of this pertains to body contouring for weight loss, but we can talk about most times for a mini tummy tuck usually would be something that we do where we just take a little bit of skin from below the belly button, but that incision doesn't usually go above the belly button. So we're taking out a small amount of skin from below the belly button. Usually not a surgery that we kind of think of when we're talking about body contouring after weight loss. Most often we're talking about a full abdominoplasty with correction of the muscles that have separated over time. So that's called a diastasis recti repair. That's something that tightens the abdominal wall, the framework. And so we don't tighten that framework. The skin is just a covering. So we really want to tighten that framework so that the skin can now cover a more silhouette framework. And that's part of a full abdominoplasty surgery. Making a new belly button to pull through after we're done can be a part of a full abdominoplasty as well. So those are the operations that we really look for when we think about weight loss surgery. Now, if the patient has a lot of skin that extends 360 degrees around them, then we start to talk about things like a circumferential body lift. And that surgery removes skin from the front, the sides, and the back. And again, that's an operation that starts on usually with the patient either on their back and then they're turned to their stomach to finish the operation, or some surgeons will start in the opposite direction. But the incision goes 360 degrees around you, and that allows you to contour everything at once. Some patients opt to treat the anterior skin excess with an abdominoplasty or tummy tuck first, and then complete the surgery with the posterior body lift or the back at a second or later date.
Oh wow. Oh wow. So that's good. I understand now. So how does liposuction fit into this whole tummy tuck procedure? And when is lipo recommended? Do you recommend one over the other?
Oftentimes, liposuction is great for sort of addressing any areas that you have residual fatty tissue um, that you want to help to contour the framework of the patient. So, if I see a patient who has really deflated skin without much underlying fatty tissue, usually I don't perform any additional liposuction. But if there
Okay.
are areas that have slightly, excess fatty tissue, then treating those areas with liposuction goes a long way to recontour the shape and form for that patient. So I think on an individual basis, it's something that I use often. I use it a little more often in patients who are not massive weight loss, because those patients tend to have a little more tissue on the hips that we can address with some liposuction.
No, okay, all right. So for patients who are worried about scarring, what techniques or advancements help minimize the visual scars?
Yeah, so I think a lot of the scar healing is partly genetics and partly just having just the best technique you can have as a surgeon. So what we can't control is the genetics of scar healing, but what we can control is how many layers of closure we perform and how those layers are performed. So, these operations are big operations and you have to repair things from the bottom up. And if you close the top layer, but the bottom tissues aren't closed well, then the scars are going to stretch and widen and look unsightly. So, as plastic surgeons, we pride ourselves on doing really complex operations, but making them look like it was simple and easy because everything looks good on the outside. But it really takes care and technique on the underlying tissues to help scars look well on the outside.
Okay, okay. So have you ever had, I have an arms question, but before I get to the arms, I wondered if you ever had like someone who had surgery, because you do reconstructive surgery, and they had like a procedure done somewhere else, and they came to you because their belly button was not how they wanted it to look. Because that's one of the things I hear people complain about is that they've had this surgery, and their belly button now is not like it was, or is doesn't look like one, or any of that. So have you had that before?
All the time, yeah,
And they come to you to fix it.
yeah. So there's so many different techniques to do the umbilicoplasty or belly button surgery, so yeah, I've corrected a lot of different forms of belly button, or we call it an umbilicoplasty. But yeah, I've done a lot of that as well. And so there's just a number of different ways to do it, and everybody out there does it a little bit differently. Fortunately, I haven't had my own patients come to me for corrections of the ones that I've done. I don't think they're unhappy with them. But I've had a number of patients who um, have had belly buttons done elsewhere, and sometimes you can correct them. It depends on what was done in the first operation, and that'll determine if you can really fix them or not.
Okay, okay. So let me ask about the arms, because I see that a lot. And that if I had one area I would want to fix, even before my belly, it would be my arms. And so, what do you call that? Are you doing lipo on the arms? Are you taking out the fat? Is it removing the skin? Is it both? How does that work?
Yeah, so the surgery for the arms we call a brachioplasty, and that surgery usually consists of a combination of liposuction and skin removal. So
Okay.
the tissues are treated with liposuction first, and that helps to deflate the tissue so that more skin can be removed. And then the incision to take the skin out, in my practice, is hidden on the inside of the arm. There are certain surgeons who put that incision on the back of the arm. I think it's more hidden if it's on the inside. It usually goes from um, just along your chest wall into the axilla or armpit, and then it goes down the inside of the arm down to about the elbow. And then you can take away a lot of that skin that's redundant. And I usually have patients in a compression garment for about 6 weeks after that surgery to help with swelling and you know, to expedite the healing process.
Okay. So I figured, because I thought, I didn't know you could do, I didn't know how safe it was or if you're doing multiple things at one time, but I always thought with the arms, you kind of need both. Um, okay, so great. So I'll ask a couple of more questions. We're going to talk about the recovery process. We're going to talk about costs and finances and, how people can pay for this. And then we'll go in the chat and then anything else you want to share. And we will tell you where to find Dr. Cody. It is in the description. I put a link in the description, but, he's the best one to be able to tell you as well. So a few more questions. So let's talk about the recovery process and the results. So what is the typical recovery timeline? Now, of course, I know it varies, but just give me an average after a tummy tuck, and what should patients expect in the first few weeks? Or tummy tuck, I don't know if this varies from any procedure, but what is that recovery process like?
So typically the recovery process is about 6 weeks for the incisions to become strong enough for patients to tolerate any sort of extraneous exercise or activity. The swelling typically will persist for 3 months or so. Most of the swelling will be gone in about 3 weeks. So I tell patients no heavy lifting, pushing, or pulling for 6 weeks. They wear a compression garment for 6 weeks. They may have drains that are in place for 1 to 2 weeks after the procedure. I expect swelling to persist for, again, 3 months or so. And the incisions or the scars, they typically, once they reach their maximum strength level at 6 weeks, they still continue to remodel and heal on the inside for up to a year.
Up to a year. Wow. So, and you said earlier, and I'm sure genetics and just your history, all of that can play into that. Do you know if someone has keloid skin? How does that play into it? Because I know people who keloid, and if you have keloid skin, you know it because a little scar or anything will have the keloid, skin. It'll heal that way. But are you cautious with patients that have that type of healing with the skin?
Yes, absolutely. So that's one of the things we look for in the preoperative consultation phase
Okay.
is to look at the earlobes or look at old scars, look at the central chest area if there's any scars there, or people who've had really bad acne to see if those acne scars went on to become keloid scars. Those are good indications for people who may be predisposed to keloiding more in the future. We know anyone with sort of olive skin and darker has a higher chance of a keloid scar. There is a different scar called a hypertrophic scar, which is sort of similar to a keloid, but not as aggressive. And so we look for all of this in that preoperative consultation phase so that we can be aware of it and talk to patients about it. And there are some things that you can do after surgery to kind of help address that, but there are some limitations to what you can do because of the genetics of keloids.
Now, I was going to ask, I think you probably hit on this, but I was going to say, how soon can you return to your normal activities? But I'm sure, like we talked about genetics, but what about age? How does age play into that? And do you have like an oldest patient you ever did a surgery on that you can
Yeah.
remember?
So, again, we look at patients as individuals, and as a part of that workup we do when we first meet patients, getting to know them, we know we learn what their sort of overall baseline physical status is. And so I've operated on plenty of patients in their 70s and 80s.
Oh,
And this
wow.
may be for, both reconstructive and cosmetic procedures as well. So really it depends on the patient's overall health status. We certainly will do checks for, your general labs, an EKG, a chest X-ray to make sure there's nothing underlying that we aren't missing. And certainly I communicate with the primary care doctor who can help me to learn more about this patient's underlying health history.
Okay, great. Okay, so let's talk about, so did you guys hear that? The age, he said he's operated on someone up in 70s and 80s. So it depends on your health more so than your age is, I think what he's saying. So let's talk about the cost because that's what I want to know. So the cost, the financing, and how insurance plays into all of this. So can you break down the typical cost range for a tummy tuck and or any of these procedures, and what factors can affect the price? So let's talk about tummy tucks. In this group, tummy tucks, I've heard loose skin tightening, loose skin operations, tightening of the skin, and where you would do your arm,
Mhm.
your arm, you would do double procedures. And then how many procedures can you do at one time?
Yeah, again, so the number of procedures you can do at one time usually is going to be determined on what can be done safely, what can be done without extending the operation to time periods where we know the complications are going to be higher. So again, that it all depends on the individual, the patient, their health. If the surgeries are, if you're, doing sometimes we see patients who have skin that hangs down to their knees from their abdomen. So that's probably not a surgery where you're going to say, oh yeah, let's do your arms too. We probably would just do that. So, weight loss surgery for me is everything from a small, you know, amount of lower abdominal skin that hangs to maybe just above the mons or the genitals to someone who has fat hanging down to their knees. I've taken off 100 pounds of just hanging skin from the abdomen. And in that situation, I would never add another surgery onto that because that's a big enough operation by itself. So
Yeah.
these are all still really individualized procedures. As far as cost goes, cost is going to be regional. It's going to be, again, if you're doing a tummy tuck, that will probably be different just depending on where you are in the country. If it's, I would guess it's going to be, 6 or 7 thousand and up from there. But again, it's going to be very regional. Again, it depends on you know the amount of hanging tissue. If there's a diastasis repair. Oftentimes, we find hernias in these patients that we need to repair at the time of the procedure. So those can all factor into to the cost. In our office, we do offer things like care credit and some financing options for patients to help spread the cost out over time.
Okay. Okay. Well, that's good to know. So to spread the cost out over time. So, and I guess unless you knew what your procedure was, it's probably hard to price it. But I like how you said it's at least 6,000, and it goes up from there. Okay. So I was going to ask too, how does your doctor play into this? So we know this is, skin removal surgery is considered a plastic surgery procedure, and most insurances don't cover cosmetic surgery. But there are ways that you could have a doctor, and I'm not saying there are ways that they're going to say
Mhm.
you need it when you don't, but if you have that much skin, that's obviously affecting your day to day, function in life. And so how do you work with those patients and doctors? Like, are you talking with the doctor? Have you seen patients who didn't have to pay anything because their insurance covered it?
Okay, so that's a good question. So oftentimes when we talk about body contouring surgery, there's a difference between an abdominoplasty and a panniculectomy. So pannus is a general term for, kind of fatty tissue. So when we do a panniculectomy, sometimes companies will cover that if there's a documented history of rashes and frequent sores and inability to maintain hygiene and things like that. So if the insurance companies agree that this documentation is sufficient, sometimes they'll cover the panniculectomy. Now, the difference between a panniculectomy and abdominoplasty usually is that you're only taking away the hanging skin with the panniculectomy. You're not really doing the undermining and repairing the muscles, restoring the belly button, because that becomes cosmetic. And so sometimes patients can have the panniculectomy portion of the operation covered, and they may choose to do add-ons for the cosmesis because if you're under anesthesia for this procedure. If you can cover the cosmetic portion of it, then that allows you to have the entire procedure done as well. But the panniculectomy is sometimes covered by your insurance, but your insurance company certainly is well aware of the difference between a panniculectomy and abdominoplasty, and will be looking to make sure that what was done was what they agreed to cover.
Now that is surprising to me because I thought they would just say, okay, this is affecting your quality of life. We're just going to do it all in the shebang and cover it, but they separate it out.
Absolutely, and I never know who's going to cover it or not, and
Okay.
I've had patients, again, um, who, I can think of, several patients who had a lot of hanging skin that myself and another surgeon, thought, was being exacerbated by the excess skin they had. The insurance company disagreed with this and refused to cover it.
Wow. Wow. So you put in requests, you can put in a request to an insurance company to cover it as well.
Yeah, so anytime if I see a patient for a paniculectomy, we usually will submit for an authorization. And
Oh,
then
okay.
sometimes we hear back with the authorization was granted, or other times we hear back and say and it was denied.
So has it been more covered or not? In your, if you just estimating.
Um, just excuse me. I would say early on in my career it was I think it's been covered slightly more lately. I'd say in the first 10 years it was I rarely had any covered by insurance, but I think I've had more covered in the last 5 to 6 years.
Okay. All right. Very good. Very good. All right. So we're getting to the chat. We're getting to the questions in the chat right now. So one of the things is, as I'm listening to Dr. Cody, and I'm going to go up to the top and start up there with some of these questions. He may need more history about you, though, as you can see, because it's individual. So you might want to say, if you're comfortable, your age or your weight or something that he might need to know to be able to answer more specifically. But let's see. Let's see. Let me see. Okay, here's a question. I think I asked this, brown velvet. I have keloids. Are any of these procedures an option for me? So you kind of addressed that, but would you not do it at all? Like, are there exceptions to that?
Yeah, so I think you still have to see the patient and see. Well, a lot of times when people say they have keloids, sometimes they have what we call hypertrophic scars, and if that's the case, then we can reasonably proceed without really the concerns that we have for keloids, and some of the treatments for keloids and hypertrophic scars kind of overlap, and there may be some options there. And some people think they got a keloid from a fall that they didn't get repaired, and so yeah, if you have an injury that happened somewhere outside where it was a little bit more contaminated and the inflammatory process was prolonged, that can be a keloid, just because the inflammation from the nature of the injury was there. Whereas in a clean surgical procedure, you don't have that additional contamination from falling on the ground in a park somewhere, and so sometimes limiting the amount of inflammation can help with those patients who may be on the border of a keloid former.
Okay, okay, thank you. Okay, we have Miss Mindy. She says, how you pronounce that word, Derek? Paniculectomy?
Paniculectomy. Paniculectomy.
Paniculectomy. Wondering what happens to the belly button. So you talked a little bit about the belly button, but how does that work?
So again, the traditional paniculectomy that's covered by your insurance does not include the belly button. Oftentimes, patients can choose to add that procedure on as a self-pay portion, and then the cost of that would just depend on the surgeon and what they charge for it. The anesthesia time, again, to recreate the belly button, usually is something that can be done in less than an hour or so, but so it can be added on. Traditionally, what your insurance considers a paniculectomy does not consider an umbilicoplasty a part of that.
Okay, okay, thank you. Okay, so we have, let's see, I had my first consult for plastics, and wow, he suggested everything. 360-degree body lift, breast lift with option of implant arm battings and legs from inner thigh. So he suggested she have all that done in one procedure. Does that sound like it's something that, you don't know her, I know you don't know her history, but is that something that a plastic surgeon would do, all those procedures at once?
Again, I think having not examined this patient to see what the degree of hanging skin is, It's very difficult to say. Typically, in my practice, I probably wouldn't do arms, legs, and abdomen at the same time. But again, if the amount of hanging skin in the arms and legs is minimal, that may be reasonable. Just kind of depends on the degree of laxity. So it sounds a little ambitious, but again, I haven't examined the patient, and it all depends on the amount of skin. And again, these are very individualized procedures, and in the right patient, doing all those things together is just fine. It's hard to say without really seeing and knowing the details of the patient's history, the amount of hanging skin, what's their maximum weight loss or weight gain. Is there any heart disease or anything like that in the background?
Okay. All right. Thank you. Rowood says, what are the requirements for a breast augmentation?
Well, so we do breast augmentation for a lot of different reasons. So, and a breast augmentation for someone who has what we call micromastia or hypomastia is very different than augmentation after weight loss. So after weight loss, there's usually more skin than there is fatty tissue or breast tissue. And so we need to address the amount of skin. So by reducing the amount of skin, we can sometimes provide what we call a breast lift, and then to add volume, we can use an implant. And so that would be what we call a mastopexy augmentation, a lift as well as a filling of the breast. And so usually in patients who are massive weight loss, we need to combine a lift with an implant to both reduce the amount of skin and also replace the loss of volume from weight loss.
Okay, thank you. Now, this question you answered, you talked about removal of skin from the arms. But what about the back? Do people come with just wanting their back fat removed? That's what I call it.
Yeah, absolutely. So to address the back, I usually offer both an upper and a lower body lift. So sometimes the excess skin and fat in the upper back and bra line area has to be addressed as an upper body lift, and sometimes the lower is addressed as a lower. So those are very common. And again, it can be done as a 360-degree procedure, or it can be done as a separate procedure as well.
Okay, thank you, Turtle Diaries, weight loss. Okay, somebody has a question. I think you answered this already. What's a good amount of weight to lose to prep for the plastic surgery? And you talked about basically your lowest weight, because if you have so much weight to lose, in addition to when you start there, you're going to undo what he's done or what your plastic surgeon has done.
Yeah, and sometimes it's difficult to know when you're at your lowest weight. So sometimes when you hit that plateau and you maintain that plateau for greater than 6 months, then you have a realistic goal that, hey, I've reached the lowest weight I can reach. I've maintained the lifestyle that got me to this point of weight loss, but now I've plateaued at this weight and it's been stable. So we look for stability in the weight. It's hard for me to say what your lowest weight is. And I'm not sure anyone can tell you that, but we look for stability in the weight loss so that we know we're at a stable point to start rebuilding the contour process.
Yeah, that makes sense. Thank you. Pam says, I also want my hood eyelids down. What is that, Derek?
Yeah, so part of weight loss surgery includes the face. The face is a very dramatic area when it comes to weight loss. We typically lose a little fat in our faces as we age, and that leads to some of the redundant skin of aging. And so oftentimes I see patients for post weight loss facial rejuvenation, and that involves what we call upper eyelid surgery or a blepharoplasty. That's where I remove the excess skin of the upper eyelids to kind of rejuvenate the appearance, to kind of help patients with that sort of tired, sort of unhappy look they may display despite feeling very happy and jovial on the inside. So upper eyelid surgery is an upper blepharoplasty. Oftentimes you still need to see someone to do a full evaluation because the brows may be starting to drop as well. And an upper blepharoplasty without addressing the brow can sometimes lead to less than ideal results. So I think all in all, things need to be kind of addressed comprehensively, but certainly that's part of facial rejuvenation. after
So
weight
the
loss.
whole now what about the neck? Because I had like this little skin on my neck, and I see a lot of women with that, and not even weight loss with age. As you age, it's like I feel like you get that neck. Because my mom was, my mom was thinner, and she started to get that neck going on. So is that a separate thing? Is that what do we call that kind of a surgery?
So again, that's usually that's done as a face and neck lift,
Okay.
and that can be certainly done in the massive weight loss patient. But usually, I see patients for facelift and neck lift surgery. Again, we address any of the extra skin. Usually, those incisions are hidden around the ear, close behind the ear as well, and it allows me to remove that excess skin, tighten the muscles on the inside. That's the most important part of a facelift is not the skin that you see, but the underlying tissues that no one will ever see. What's done to those tissues is what makes a good facelift.
Oh, I didn't know they were tightening muscles in the face. Wow. Okay, Diana says, "Hi everyone. I would like to ask what qualifies for plastic surgery." You kind of mentioned that, so if you want to, reiterate that really quick.
Yeah, again, so for paniculectomy, oftentimes insurance companies want a documented history of frequent rashes, infections, sores, abscesses related to those folds, and those folds can be on the abdomen, they could be in the inner thigh area as well.
Okay, thank you. Taisha says, "Do you perform umbilicoplasty surgery?
Absolutely.
Umbilical.
Yeah, that's, so for, every tummy tuck, again, I've seen patients who've had um, unsuccessful umbilicoplasties and at other places and who've come for correction. I've also treated patients who've been born with certain conditions where their belly button um, was disrupted at birth and have recreated belly buttons for them as well. So there's so many different options for doing a belly button. And so, I do it for cosmetic purposes. I do it for patients who, for congenital reasons as well.
Let's have some nice comments saying thank you for joining us. Okay, so here's another question. How do you determine from Debbie's weight loss revolution? How do you determine if someone is a good candidate? We just talked about that in skin removal. So we'll go to the next one because I think you really hit on that. Um, so Pam says, so far my insurance came back approving as medically necessary. The doctor's office says the only thing is they don't know how much the insurance will pay, so I have to pay up front, then get reimbursed. So is that a thing, paying up front and then get reimbursed?
Yeah, again, there's so many different ways to to kind of finance these, and sometimes going back to the insurance company with the bills and having them reimburse you. Certainly, that's one way that you can finance this or get it covered as well. Yeah.
Okay, I see. I would have never thought they would do that. That was a good question, or statement. So, Debbie, that's a good question. That was my question too, because of my years of steroid usage for my asthma. Doctors don't want to touch me for asthma.
Yeah, so depending on so steroids definitely reduce the healing, and you have
Oh,
to be more cautious of complications after surgery. And these are usually complications with wound healing. So,
okay.
one thing we didn't really talk about earlier were complications related to surgery. So these surgeries are done under general anesthesia, and so there's always a risk of a blood clot. And so
Uh,
during your surgery, your legs are usually treated with some sequential compression devices. Oftentimes, you may receive a blood thinner prior to your surgery to help with reduction in what we call um, deep venous thrombosis. So, after surgery, it's very, very, very important for you to go home and walk, walk, walk. Your doctor's going to tell you, I want you to walk around your house several, you know, times a day. I mean, every hour. And that's very important for you to be compliant with because that reduces the risk of a blood clot. We give patients usually a dose of antibiotics before their procedure, and that helps to reduce the risk of a wound infection. Typically, those antibiotics are continued on an outpatient basis, but it does help protect you from wound infection. Doesn't give you 100% protection. Again, these are large operations. There's bacteria that live in our skin that are helpful. Um, and if given a chance, sometimes they can become harmful. So that's always a part of the risk as well. Um, Going to someone who can does a good exam to determine if you're a good candidate will help reduce these risks, and certainly compliance with the treatment protocol will help as well.
Okay, thank you. Debbie says, what are some common risks of any of these plastic surgery
Look, well,
procedures?
I think the big risk, the ones, we just talked about, blood clots. Those can slow the healing process. Those can travel to the lung and become fatal. Wound infections can be a big problem as well. Um, and depending on the amount of tissues that are removed, sometimes wound healing issues can be a problem. Usually, the wound healing issues are readily treated with some local wound care and a little bit of time, and those will continue to heal. And sometimes a scar revision can be done later on if needed. So those are the big risks to the procedure. Again, there can be some small areas, um, you know, fluid collections like seromas, uh, sometimes bloody fluid collections called hematomas. Those can be complications as well. Those are all easily managed, usually in the office without additional surgery.
Okay. And what about if someone has lymphedema, where your legs are swollen and hold water? Would you perform plastic surgery on someone, not necessarily on their legs, but anywhere? Is that something you should avoid? A plastic surgeon would avoid if someone had that condition?
Certainly, you need to be acutely aware of any conditions like lymphedema, particularly if you're doing a thighplasty on a patient with lymphedema. It's something that in my practice, there's certain things we do for lymphedema that's usually not. So for lymphedema, I don't really offer cosmetic surgery. So there are other sort of reconstructive procedures that can address lymphedema, but usually they're not thighplasties or cosmetic surgeries. It's a different sort of physiology or pathophysiology that needs to be treated with a different technique, and usually they're not cosmetic in nature.
Now, would having that prevent you from getting a tummy tuck or a breast augmentation or anything like
Usually, it
that?
won't prevent you from getting a tummy tuck. Certainly, it may play more in you having the ability to contour the thighs.
The thighs. Okay, that makes sense. Yes. Okay. All right, let me see. I'm scrolling down. I'm scrolling down. 2.0 mommy. Wait. 2.0 mommy says, I have a severe, what is that? Diastasis recti from
Yeah, that's
10
it's correct. Yeah.
10 births. She's given birth to 10 children. God love her. Can you explain what surgery for that would entail? Also, how successful is it in keeping the muscles together long term?
So with most um, patients who've had either massive weight loss or multiple childbirths, so we have our stomach muscles, the abdominis recti. Um, there are two of them, and they start out touching each other in the middle, and they go right through the belly button area. So over time, once they're stretched out, sometimes with weight loss or after the delivery of children, those muscles come back to the middle. After multiple births, sometimes they don't come back to the middle,
Oh,
and they
wow.
leave a separation, and it's called a diastasis recti. To correct that, those muscles are sutured back together in the midline, usually with a permanent suture, and usually anchored to the pubic bone to help with longevity. So it's usually a very successful procedure, provided that you're compliant with the recovery phase. Early on in the recovery phase, you can certainly overpower the suture repair, but if you allow yourself time for your body to reinforce that repair, typically it's a lifetime repair.
Now they need to give her a discount just based on
Mhm.
having 10 birth, 10 children. I think that's amazing.
That is
But what would
impressive.
I'm sorry, what'd you say, Derek?
That is impressive.
That is impressive. Now, what would her recovery time be like? Because I know this lady does some strength training now. So let's say she had that procedure. I know you don't know her, but like what would be the typical, you
Yeah, so
know,
the typical recovery is still going to be about 6 weeks. So under the best conditions, it takes your body about 6 weeks for scars to kind of reach their full strength, and that's very different from scar maturity. So, scars reach their full strength in about 6 weeks, but they don't fully mature for, again, like we said earlier, about a year.
Oh, wow. Okay, great. Great information. Thank you. Taisha says, what would having a I don't know what that is. I'll let you pronounce. Do you know what that is? How to pronounce that?
Heterozygous prothrombin mutation disqualify from having cosmetic surgery. So again, oftentimes that can be something that disqualifies you in certain. Again, I think it really boils down to a visit with a plastic surgeon where they look at a detailed history of your DVT risk, family history, personal history, um, you know, uh, have you seen a hematologist to kind of confirm this heterozygous state? Those are all things that need to be addressed. Sometimes it can be done safely with patients on blood thinners for a little longer time after surgery. But sometimes it may be that, the risk is too high and you need to kind of, defer your surgical plans. So, again, so a lot of these genetic conditions that lead to um, clotting disorders have a variable, what we call penetrance or um, amount of effect that they may have. And sometimes they're, you know, barely noticeable, but sometimes they can be catastrophic. So really looking at that as an individual is going to be very important. But it can be something that disqualifies you for certain from cosmetic surgery.
It can disqualify you. Is that called heterogous?
Yeah,
Right.
heterozygous prothrombin mutation. So that's just
Got it.
one of many different types of genetic abnormalities that may lead to blood clots.
Wow.
And the reason why I say that is, the reason why I say that it doesn't always disqualify you is because sometimes in reconstructive surgery, we don't have a choice but to operate on patients who have these sort of clotting abnormalities. And we know
Okay.
it can be done successfully, but it needs to be done with extreme care, caution, planning, and with as much preoperative planning as possible to make it safe and efficient.
Okay, great. Thank you. I just had to try to pronounce that word because I tell my students, don't give up when you give to a
Yeah.
tough word. So I had to try it again.
Yeah.
Okay, Debbie's weight loss revolution. How much is the average weight loss with an upper and lower body skin removal surgery? I think you kind of answered that already, but I don't know if you feel
Yeah,
like you
well,
have.
so it just depends on where you start. Um, weight loss after certainly it's not a weight loss surgery, but you're gonna lose some weight when you take off this extra skin. Again, the most I've taken off was 100 pounds of skin hanging from a patient's abdomen, but this skin hung down to her knees, but again, it's different for everyone. So just depends on I don't think there's an average, or if it is, I haven't calculated my average. I've taken off as little as 100 grams or maybe not 100 grams, 500 grams to 100 pounds.
Wow. Wow, that's a lot. Bellflower, she would love to know if lipo and J plasma, or I don't know if she meant to put that J there, plasma would be sufficient for those who are afraid of the tummy tuck.
Okay, it's a good question. Again, we talked about skin contraction, and if there's loose skin that's not going to retract, then liposuction is not a good idea in that situation because liposuction could result in additional skin laxity. So, again, having a consultation with a plastic surgeon to assess the amount of skin laxity you have and skin elasticity will help determine if you are a good candidate for liposuction alone. Typically, in the massive weight loss population, liposuction will result in additional skin laxity without skin tightening.
Okay, thank you. That was a good question. Let's see, I'm scrolling down. Um, do you have experience, documentation to try and get insurance to cover as much as possible? Losing 350 pounds when all is said and done. I know I want it.
Yeah, so I mean, again, when I deal with insurance companies, I just document as a physician. You know, I document my findings objectively, and you know, I deal with, I don't know, hundreds of different insurance companies. They all have their own sort of policy manuals that determine what they cover, and you know, there may be, you know, 500 people across the country reviewing requests for authorization, and so, you know, I don't have the manuals for every insurance company to what they consider medically necessary. So I just document it objectively as a physician, and usually that keeps me safe from a medical legal standpoint, and keeps patients safe as well. And it's because insurance companies aren't trying to come after them for surgeries that they didn't deem medically necessary.
Okay. Okay. Let's see. Oh, this is just a nice comment. I've always had large arms and would love to have my arms done. I'm 189 pounds. I have 50 pounds to go. Great incentive to reach and maintain my goal. It is, especially if you know you're interested in having this surgery. So we have, oh, I think you talked about this earlier, arm lipo versus brachioplasty. Can you choose lipo with J plasma skin tighten instead of surgery for a better look?
Yeah, and so again, there's, you know, if you know, there's so many products on the market that try to tighten the skin externally, um, and those products are certainly much more effective in the non-weight loss population. Um, and it's very difficult to control some of these external skin tightening modalities. There are a number of them on the market, and again, the amount of tightening you get is hard to predict, particularly in the massive weight loss population. Certainly doesn't preclude someone from trying it. Sometimes these tightening procedures cause some scarring, um, which may make surgery afterwards more difficult and challenging, though.
All right, thank you. Now, this is
You
an
know, and that's in the case. Say you try one of these procedures, liposuction and external skin tightening, and you weren't happy with it, and now you realize that you need surgery. That may make that surgical operation more complicated.
Oh, yeah, okay, okay. So you kinda have to kinda have your know what you want when you're coming, especially for, any kind of surgery, I would imagine. I thought this was interesting. Some people say that they would opt to not have a belly button if they did it again because they had an infection in the belly button. Now, what would bring that on?
Yeah. So again, there's bacteria on the skin, and sometimes the belly button is. So there's a number of reasons. You know, you're cutting around the belly button, and that means the blood supply is a little bit compromised, and so, you know, it takes a while for the blood supply to recover. There's bacteria on the skin. Whenever they can find a break in the dam, they'll go for it. So usually it can be managed pretty well in the office, but a lot of this kind of, you know, I try to preserve as much blood supply to the belly button so that there's plenty of circulation to get there to heal the tissues well, and take the immune system there to prevent infection and things like that. So um, yeah, usually the belly button is not a big issue, but it can be sometimes for sure.
Right. Oh, yeah. Oh, yeah. Okay, thank you. Miss Toy, the review, I think we answered this already, but how many procedures can you have at one time? People were asking questions before, we
Mhm.
even
That's
were
okay. Yeah,
talking.
yeah. Again, this just depends on the patient, and you know, the size of their different procedures, their health status, and so it's individualized.
And it makes sense. Debbie's weight loss revolution. What are some exciting new advances coming available in plastic surgery right now? That's an excellent question. That's an
It
excellent.
really is. So, you know, as plastic surgeons, we're constantly innovating and finding new ways to do what we do more efficiently and effectively. So some of the new things is, you know, we are coming out with more non-invasive procedures. Again, the non-invasive procedures tend to allow for some tightening without the incisions of surgery. Again, I think we're at the stage where this works better in some of our non-weight loss populations, but we certainly think we'll be expanding these to greater and greater populations. But we want to make sure that, you know, they can do what's promised, and so I think those are going to be promising things that we're doing in plastic surgery. Right now, for facial rejuvenation and after weight loss, I'm adding fat to faces actually because we look at a baby's face. We love a baby's face. It's nice and plump, and so we add fat to faces, and we really need to kind of. I think that's exciting and something that we have a lot of promise there.
Now, let me ask you, so when you're adding fat to faces, you always hear when you add fat to your bottom that if you're not eating correctly and exercising, it moves. So is the face in your fat, is it a possibility that that can move?
Um, so it's certainly there can be some migration of the fat. However, when we're adding fat to the face, these are really small fat particles. These aren't
Okay.
large clumps of fat, and even when I add it to the buttock, these are still small particles of fat that are evenly dispersed throughout the tissue. So, there's ways to kind of minimize migration and things like that. And so, certainly, I think the big thing with adding fat to the face is that you have to realize that the fat will always act like where it came from, and fat from the abdomen tends to grow at a different pace than fat in the face. And so being cognizant of that will allow you to add fat to the face efficiently without some of the untoward side, complications that can happen if you're not aware of that.
So where is the fat coming from your face to put in your face? Where are you taking it from?
It depends on the patient. Sometimes it's the abdomen, sometimes it can be, other places.
Do
Um,
they choose or do you choose?
it's a it's a shared decision. If patients, again, if patients have areas that they desire to reduce the contour to, and we need fat for grafting and for a different type of procedure, that's a shared decision between myself and the patient.
Oh, very good. I love that. I love that. Okay, so Dr. Cody, I have been hearing of using brackets or something like that for arms to create a better scar. Do you do that? I think it's another word, something like bracket. So she's not sure if it's called that.
Again, so the brachioplasty, if we look at the skin of the inner arm, is very thin. And so the brachioplasty scar can sometimes be a scar that can be prone to sort of widening and hypertrophy. So again, the way I avoid that is a multi-layer closure where there's no tension of the skin,
Okay.
and then compression for 6 weeks to help expedite the healing process. However, there's not a whole lot of things that we can do to change the genetics of wound healing. There's nothing you can rub on the skin that's going to change the genetics of wound healing. So I think you have to have meticulous technique, and you have to understand that the inner arm skin is thin in everyone. If you pinch the skin of your inner arm and then pinch the skin on your back, you can see the difference in thickness.
That makes sense. So since you talked about rubbing on the skin, they have all these creams and um, to put on your stretch marks or anything on your belly, especially the stretch marks. Have you seen any of that work, or if they eliminate scars or reduce the effects of scars?
Yeah,
'Cause some
yeah,
doctors recommend stuff. Have you seen that? I mean, what do you know about that?
there's some products that have a small amount of data that can be helpful. Um, Again, but there's not a lot of products that are going to change the genetics of wound healing. So, um, the industry is there, but the data is still lacking behind. Um,
Okay.
and again, as a plastic surgeon, you know, the things we can control is how we handle those tissues. You want to handle the tissues gently. You want to make sure you're closing from the bottom up, dispersing the tension so that it's not on the skin. So those are things that you can do to improve your scar quality.
Okay. Thank you. Bellflower says fat transfer to breast versus breast lift versus breast implants. What option is the safest and best for deflated breasts after weight loss? That word deflated gets me every time.
No, that's really a great question.
She
Again,
has some great ones.
I've done both, and so in the right situation, not everyone wants to have an implant that they have to maintain. So to restore that volume, sometimes fat grafting to the breast is a great way to restore the volume after massive weight loss, and it avoids the complications or maintenance that can be associated with an implant. So again, in the right situation, with the right conversation with your plastic surgeon, you may be a candidate for a mastopexy with fat grafting to achieve your breast goals and results. And there are some trade-offs. You know, an implant's going to give you a fuller look than fat grafting, but a fat grafting will give you a very natural look without the maintenance of an implant. So it depends on what the patients want.
Okay, so I get so with the implant, I feel like it holds it steady. Now I don't have an implant, so I don't know, but that's just what I would gather because of how it's constructed. So that fat though can be loose and moving. So what do you do? You give well, you know what I'm saying? Like it's not like that implant holding it. So what do? You give a breast lift as well to
Yeah, absolutely.
keep
So
it
you
up?
must address the skin envelope. So after
Okay.
you address the skin envelope, you can kind of match the volume to skin ratio. So, you know, you want to have enough of the soft tissue volume so that the envelope is full.
Okay.
And that fullness can come from an implant or that fullness can come from a fat graft. Um, you know, again, after a massive weight loss, you know, the implant's going to have some extra pull on the skin. It's going to be heavier, firmer. And so you have to think about, does this patient have the skin quality to maintain an implant in a good position?
Yeah.
Because certainly if I put an implant there, I want it to look good for a very long time. And so I need to look at your skin quality and say, look, you know, you may want this really big implant, but I don't think your skin quality, particularly after weight loss, is going to tolerate this implant and maintain it in a position where both you and I are going to be happy. So there's a lot of things that are just really individualized that we can address with patients through, you know, a detailed conversation and some shared decision making to get the best outcome.
Somebody wanted to know, Val, where you from? And I said Ohio. So at this point, you can, if you want to expound on anything,
Yeah,
I probably.
so I'm in private practice with Crystal Clinic Plastic Surgeons. I have offices in Cleveland and Akron and throughout Northeast Ohio.
Okay, very good. Mia wanted to know, do you do the surgery before it's all paid for? Yeah, we really didn't say that.
Yeah,
Um,
well, so you know things like care credit usually, if it's cosmetic, so you know there's a certain amount that we collect before the procedure, um, and if patients are paying all in cash, um, then that's usually collected before the procedure. If it's a care credit thing, it's something that's usually done through that. We have other financing options through our office as well.
okay, very good. Is this a question? Breast job, not sure what will be needed properly, a lift, but does the Oriella, or is that Oriella
Ariel,
get
yeah.
areola get corrected too? You know these babies need to.
Yeah, so whenever you do a lift or a reduction, you know, the areola has the option to be addressed as well. So usually it's a reduction in the areola size with a lift or reduction. Yeah, that's part of the procedure.
Okay, okay. Now I think you addressed this. Thank you. I think you addressed this. I always hear if your insurance covers a panniculectomy, you can add on additional surgeries, and I think you did say that. But the question she's saying is that the most expensive part.
Oh, that I think she's referring to anesthesia.
Oh, okay.
I guess Anna is
It's
anesthesia.
anesthesia. She's always using acronyms. I can't keep up. Okay.
Uh,
So
yes.
is that? Oh, okay. Go
So
ahead.
yeah, sometimes you know, depending on where you are, the anesthesia may or may not be the most expensive part. You know, there's facility fees, there's anesthesia fees, there's a surgical fee, but oftentimes patients can add on some additional procedures and with a combined reconstructive surgery like a panniculectomy and a cosmetic surgery like a umbilicoplasty or diastasis repair.
Okay. Insurance, Mia says insurance doesn't want to pay for skin surgery. You have to work hard, I'm told, to get coverage. Um, What do you mean work hard, Mia? Like, because he's
Absolutely.
saying,
So insurance companies do not typically like to cover skin removal surgery because they view it as cosmetic, and they're going to view it as cosmetic, you know, often. And so sometimes, I tell patients, um, insurance companies are kind of working for you, and they get requests from, I don't know, hundreds or thousands of doctors every hour for authorization for surgery. And they can easily kind of look at this authorization and rubber stamp it, yes or deny, and go to the next one, rubber stamp, rubber stamp, rubber stamp. But the way you come off of that page is when you call and talk to your insurance company and say, you know, I am a person, I am dealing with this every single day, and I would like your assistance in addressing this. So insurance companies work for you, and hearing from you as patients is a good way to get the attention of the insurance company to let them know that, I know you see a lot of paperwork every day, but I'm a person behind this paperwork, and this is how it's affected my lifestyle.
I absolutely love that. So being an advocate for yourself, even with the insurance company, the way to go. So thank you for that, because I think a lot of times people hear a no and they're done. Like it's like, okay, they said no without being, more, um, more, I don't know what I want to say, but advocating for themselves, saying, no, this is affecting me. And I think, so you can do that even without your doctor. If you and your doctor were both doing it, I think that would be even more effective, your primary care physician, calling
Absolutely.
insurance companies.
And I think being an advocate for yourself is a good point that we haven't talked about in the bigger sense of medicine, but before any sort of medical procedure, cosmetic or reconstructive, patients need to advocate for themselves. You need to research your doctors, um, look at reviews, um, go to your consultations with a list of questions. Um, you know, have someone with you if you don't think you can gather all this information on your own. Um, get a second opinion. I've never been offended by a patient who got a second opinion. Hey, I'm going to be here. If I would rather you get a second opinion and have all your questions addressed. So that's never a bad thing. You should never feel any way than good about a second opinion, and really advocate for yourself. And that pertains to, you know, if you were given a referral somewhere, it's still up to you to vet this person you were referred to.
Okay, thank you for that. I think you kind of touched on this, but let's see. So Delilah says, Dr. Cody, what documentation do you feel is needed to help get insurance coverage?
Again, that's going to be a little bit individualized, of course. Typically, they're looking for, things that are affecting your daily lifestyle, um, and rashes, sores, and things like that. But it's going to be a little bit individual, and most of them want to see photos. So,
Yeah.
I typically take photos that are submitted along with my notes from the office visit to the insurance company.
Now, so you're documenting this. So what part of the process do you, because I don't know, some people probably don't have I always assume, and I shouldn't, and not assume, but I always think like most people have a primary care doctor, but I realize being, on this channel, they don't. And so if somebody doesn't have that primary care physician, because I know you said you kind of work with them at times, then what do you do? Like, so you're helping to document things. Would you work with that patient and say, let's document, some of your medical history, or maybe in so many months,
Yeah, yes, yeah. So again, you know, I do a thorough history and physical for anyone who's going to have surgery, just to make sure things can be done safely. I think where it comes into play, it's always good if you have a primary care doctor, because there are a lot of people who have underlying conditions that they aren't aware of, and sometimes your primary care doctor is the key to unlocking those things that may be in your history that you aren't aware of. And we have the option of sitting and talking for an hour or 2 hours, or you can come back for a different visit, but that's no sort of substitute for someone you've kind of documented your care with over 2, 5, 10, 15 years. So they really get to know your history very well, and I don't want to ever think that I can replace the knowledge that you've built with your primary care doctor and an hour long patient consultation. So I think it's very important for people to have a primary care doctor because they are the gatekeepers of medicine, and certainly as a physician, I still do a full history and physical exam. But again, how you responded to different medications in the past, there's so many nuances to medicine. Some people can tolerate one pain medicine, but they can't tolerate another one. And there's just so much to glean from our colleagues in primary care that they just can't be excluded from this.
Okay. You can see the comments too, Derek?
I don't see comments. Let me see here.
Okay, that's okay. I just want to make sure before you go that we get to some of the ones that, maybe you didn't hit on. Tanya says, I've lost 70 pounds and I am 60 years old. I have excess loose skin on my thighs. What about a thighplasty?
Yeah. Thighplasties are a part of this. That's a big part of this. So typically it's the abdomen. In most cases, I do the abdomen. Most patients say the abdomen is their number one priority. Next is probably the arms, and the thighs are always there. So there's two types of thighplasty. One's vertical thighplasty, one's a sort of crescent thighplasty. Most patients who've lost a lot of weight require vertical thighplasty. That incision goes down the inner thigh. Certainly is a great way to recontour the thigh. Again, most likely you're going to have some compression after surgery. You're going to have a drain in the thigh for a little while. You're going to limit your activity as far as strenuous exercise for 6 weeks. Expect some swelling for 3 months. It's usually a combination of liposuction and skin excision. So certainly this is a major part of post-weight loss body contouring.
Okay. Jen says, I had a breast reduction about 7 years ago. Now they are more deflated than saggy after 100 pounds down. What are the best natural implants, not too high on the chest?
Again, so this kind of goes to, not doing your contouring too soon, even though breast reduction is very different. We do those for neck, back, and shoulder pain, but after you lose a lot of weight, you can have that deflated skin. So natural, it could be fat grafting, or again, it could be an implant. So it depends on what your goals are. And really the only way to get to those goals, again, the implant can do a few things that the fat graft can't, and certainly that comes at the cost of some maintenance for that implant. There's certainly, depending on the skin quality, you can get a good result with fat grafting as well. The implant gives you a little bit more fullness in the upper inner part of the breast, though.
Okay. So, I was thinking of Dr. Deb Zimmerman says, my doctor says as you age, there's a concern about dementia being caused by being under anesthesia for too long. What are your thoughts?
So, we don't have any, hard evidence that says anesthesia leads to dementia. There's, we're operating on patients for medical conditions throughout life as it comes to it. We don't withhold anesthesia for people as they age because we think we're going to cause dementia. If there's something that's medically necessary, we do it. Again, looking at the patient's overall health status is important before you embark on any type of surgical procedure.
Okay, now this is kind of maybe a follow-up because you answered I think a little bit of this question before. And then, so I'm going to let you, can you see that question?
Yeah, I can see it. What would the downtime be for Zoom? Yeah, the downtime for strength training is going to be 6 weeks.
6 weeks. Okay, yeah. 6 weeks, Taisha. Okay, let's see. Let me see if there's another question. Let's see. So a lot of these questions would have you would have to meet with a person, a plastic surgeon, Dr. Cody, anybody, to get more specific things. Miss Toy, the review says, how long will you have to stop your GLP-1? Oh, that's a great question. If you would even have to stop, how long before or after the surgery?
Yeah, so with the GLP ones, you know, excuse me, there can be some delayed gastric emptying, and so we typically recommend you stop the GLP-1. Initially we were having people stop it a week ahead of time, and it all depends on some of the other risks. I think we decreased that time frame down to just the day before now. But initially there were some concerns about delayed gastric emptying, and patients were being requested to stop their GLP-1s for a week ahead of time for surgery. Those concerns have been relaxed a little bit though. But still, that's
Okay.
something that you want to meet with your doctor about.
Okay. Val wanted to know if you had a YouTube channel.
So I have a website. I do not have a YouTube channel. I find myself in the OR quite a bit, and when I'm not in the OR, I want to do some non-work stuff. So I do have a website. I am a member of the American Society of Plastic Surgeons. If you go to the website, the American Society of Plastic Surgeons, plasticsurgery.org. You can put my name into find us surgeon, and there are photos on their site that you can view. Certainly, there's some photos on my website with our group practice as well. So, plasticsurgery.org will take you to the American Society of Plastic Surgeons website, and you put my name and find a surgeon. You can see before and after photos.
And I have the link to Crystal Clinic Plastic Surgeons in the chat in the description. So they can also find you there. Now, let me see if I see any more comments. This has been an hour and a half of pure learning for me, and I'm sure a lot of us. So I just want to make sure I'm getting to everyone's questions. And then maybe you could come back and people could come on here with us and maybe ask more specific questions to their, situation.
Yeah,
So,
I'm happy to come back anytime.
okay. All right. So he said he'll come back and then we'll have people come on. I don't see that anybody else had a question. So if I missed your question, going once, going twice, put it in the chat. Wow, thank you, Dr. Derek. A lot of factors to consider for tummy, arms, and breasts. Good stuff. Yes, it is good stuff. Such great information. We appreciate your time and candidness on a Sunday, and thank you too. And I love, Dr. Cody, Derek, how you're just not telling us to do this and do that because you want people to come to your practice or anybody's practice. You're really advocating also for the patient, and I think that's what makes a great doctor. When you feel like you have somebody who's just not trying to perform every surgery or steer you down a path just to because they want to perform an operation or a surgery, you've found a good person. So I appreciate that. I picked up on that. I knew that about you anyway, but it came out in this interview. And I think advocating for yourself, so that's the one message I took away from this. Dr. Cody, is there anything you want patients to take away before we end today?
Yeah, well, thank you. I'm honored to be here. So, yeah, I think from a take-home standpoint, you know, meet with someone, make sure you're comfortable with that person. Again, come with questions, you know, make a second visit, um, get all your questions answered, and never feel bad about getting a second opinion. And again, research your doctors, research your doctors, research your doctors.
Research your doc. And that is so cool. You told them where to go to find you, right? So they know where to go to find you. I'll get that from you to put that in the description too, the site you talked about. But I do have, where your practice, I have your site in the chat. So thank you so much for coming. This has been awesome. What a great learning experience this has been. He said he's going to come back. So maybe in the summertime, when the summertime comes. Now, is your practice busier in the winter or the summer months? I wonder.
We typically have a really busy winter, the fourth quarter, which is winter. January is usually a little bit of a lull because the fourth quarter is usually a madhouse. So Usually
Okay.
there's a little bit lighter time in January, February. But fortunately, I stay pretty busy year round. So usually I'm booked, 3 to 4 months out.
Now, do you do virtual appointments, Dr.
Yeah, we
Cody?
do virtual appointments.
Yes, Taisha, he does do virtual appointments. So that's great. On that note, we're going to end this live. Thank you so much, Dr. Cody. You don't log off, but I'm going to end the live stream. All right, thank you so much for coming today. I will, talk about my weight loss on another day, maybe tomorrow, maybe on Tuesday for the week. But this was well worth it hearing from Dr. Cody. Thanks again. Have a happy Sunday and have a great President's Day tomorrow. Bye.
Thanks, everyone. Bye bye.